老师您好。
你好，请问您叫什么名字啊？
我叫小爱，
今年多少岁
25岁，
您的乳腺什么问题啊？
有乳腺结节。
乳腺 X 线检查的最佳时期是月经后的7到14天，请问您现在在这个范围内吗？
在的。
The recommended best time to check is the 7th to 14th day of the menstrual cycle. Carefully check the photographic examination application form to understand the condition.
好的，您稍等，我核对一下信息。
Clarify the location of the photography and the purpose of the examination.
您请跟我进来。我们的检查需要您将上衣全部脱掉，您脖子上的项链也需要摘掉，然后您的头发比较长，您需要把头发扎起来。桌上有橡皮筋。您的乳腺和腋窝最近有没有涂抹什么药物？
没有。
好的，那您到帘之后把衣服脱掉。
Ask the long-haired patient to tie her hair. Remove her top and accessories. Fully expose her breasts and armpits, and ensure that the medicines, stains, and tapes on the skin surface of the area were removed. Privacy protection. The airtightness of the examination room is good, and non-related personnel are not allowed to enter and exit at will. Prepare the equipment. Return the ball tube. And check whether the compression plate is intact and free of cracks. The radiography table, breast compression board, mask and handrails and other places that directly contact the patient's skin should be disinfected. Radiation protection. Doctor-patient communication.
我给您讲一下，这是在检查过程中，我们会使用压迫板加压你的乳腺。加压的过程中，乳腺可能会有点疼痛。如果您受不了的话，可以及时告诉我，我们立即停止检查。
好的。
好，没问题。那我们现在就开始检查。
Posture design. The patient stands naturally facing the mammography.
您的双脚分开与肩宽。
Feet shoulder width apart. Shoulders about the same height. Head turned to the left. The ear is attached to the panel. The right face close to the panel. Hold the armrest tightly with your left hand. Fix your body. Relax your right shoulder. Hang your right hand at your side, and lean your body forward slightly. The technician stands on the right side of the patient, lifts the mammary gland lightly, places it on the imaging platform, adjusts the imaging platform to a suitable height, lifts the breast tissue and moves forward, touches and confirms the position of the lower edge of the mammary gland, raises the imaging platform and the elevated contact with the lower edge of the mammary gland. The patient's sternum is close to the edge of the chest wall of the detector platform. The technician lifts the inner and middle glands of the right breast to the imaging platform, pulls the outer breast tissue away from the chest wall, and fixes it on the imaging platform. The mammary glands are flattened and slowly pressurized. Gently push the patient's back to prevent the breast from detaching from the compression plate, while protecting the shoulders, the skin and ribs above the mammary glands for relieving the stretching of the subject's skin during the compression process and reducing the pain. At the end of the compression process, the hand that fixes the mammary gland moves toward the nipple, stretches the glandular tissue, pulls it out from the front, flattens the skin folds on the outer edge of the mammary gland, and continues to press until the breast is sufficiently firm. Instruct the patient to keep the body still, and check whether the head, jaw, shoulders, fat skin on the breast, hair, etc., are shielded from the radiation. During the examination, you need to keep still, and you need to hold your breath when you are exposed later. After the examination, the compression plate will be released naturally, and you can move. Please keep still. Hold your breath. Start the exposure after holding your breath. Please relax. After exposure, the compressor is automatically released. Radiography parameter design. According to the size of the breast, choose the appropriate breast compression plate. Under normal circumstances, the automatic mode is used to optimize the photographic parameters AOP exposure, manual mode, tube voltage 25-35 kV, tube current 50150 mA/s, pressure value 180 nanometers, personalized adjustment according to the gland thickness of the subject. Image post-processing. Adjust brightness, contrast, crop appropriately, and determine left, right, and volume as marks. Image quality control. The CC positions of the double-measured breasts are spherical when they are placed relative to each other. The nipple is in a tangential position and cannot overlap the breast tissue. No skin folds. The base part containing the mammary gland shows part of the anterior edge of the pectoralis major as much as possible. Adipose tissue fully reveals the adipose tissue behind the mammary gland parenchyma. The difference between the length of the posterior nipple line between the CC position and the Malot position must be less than 1 centimeter. Fine calcification lesions can clearly show 0.1 mm fine calcification. No motion artifacts and other artifacts. Clinical application. Observe the shape of breast glands, breast space occupying lesions, pathological discharge or abnormal skin changes, etc. Breast oblique Malot position. Body design. Hello. You can relax now. We are now shooting obliquely. Come on. You move back a little. Adjust the angle of the ball tube and the detector. 55 degrees to 65 degrees for tall and thin ones. 45 degrees to 55 degrees for shorter and fatter ones. Okay, you go forward. The patient stands naturally facing the mammary gland equipment, with his feet shoulder width apart. The patient's right hand is placed on the handle, and the elbow is bent to relax the pectoralis major. Hold up the movable tissue of the mammary gland, and make the patient's pectoralis major and pectoralis major. The detectors are parallel, and the body angles of both breasts are kept the same. The technician pulls the upper arm fed outward, pushes the patient's right shoulder forward, and moves the right underarm tissue into the irradiation field as much as possible. The technician relaxes the patient's shoulders, uses the left hand to gently pull the right underarm and pectoralis major muscle forward, so that the movable outer edge of the breast is more obvious, and at the same time pulls the breast gland upwards and outwards away from the chest wall to avoid tissue imaging overlap each other, and press slowly until there is enough pressure to make the breast and underarm tissue stretched and fixed on the detector. And finally pull the abdominal tissue and the skin on the side of the chest wall downward to expand the breast below, and the skin folds on the side of the chest wall. Instruct the patient to use the left hand to pull the left breast to the outside to keep away from the irradiation shadow, and raise the chin to prevent covering the irradiation site. When you are exposed later, you still hold your breath and keep your body still. Please keep still and hold your breath. Start the exposure after holding your breath. Start the exposure after holding your breath. Please relax. The compressor is automatically released after exposure. Radiography parameter design. According to the size of the breast, choose the appropriate breast compression plate. Under normal circumstances, auto mode is used to optimize the photographic parameter AOP. Exposure, manual mode. The tube voltage is 25-35 kV tube. The current is 50150 mA/s, and the pressure value is 100,180 Nm. Image post-processing. Adjust brightness, contrast, crop appropriately. Identify left and right and body markers. Image control. The left and right breast images are placed symmetrically back to back in a diamond shape. The pectoralis major is fully displayed. Its lower edge can continue to the posterior nipple line or below. Adipose tissue in the posterior part of the parenchyma is fully displayed. The chest wall tissue fully shows the stretching of the tissue in the lower fold of the mammary gland. Breast tissue without sagging nipples show tangential position. No skin folds. The image layer is clear and the lesions are clearly displayed, can show fine calcifications of 0.1 mm. No motion artifacts and other artifacts. Clinical application. And lesions of breast glands, axillary lymph nodes, lumps, etc. Inspection is over.
你好，请放松，检查结束了，我会允许下您的防护用品。好，您好，请穿好您的衣服，拿好您的随身物品。这是您的检查单，请您拿好您的单子，请您及时取走您的检查报告与胶片。
好的，谢谢。
请问您还有什么疑问吗？
没有了，
好的，您可以从这离开了。
谢谢。
Body design.
你好，我们现在还要进行一个侧位的拍摄。您先往后退。
Body position design and operation process. Rotate the X-ray tube arm 90 degrees. You go forward. The patient's arm to be tested is raised above the imaging platform, holding the armrest, and the elbow is bent to relax the pectoralis major. The top of the imaging platform is under the armpit, and the patient's metaxillary line is close to the edge of the imaging platform. The technician's hands are lifted upwards and pulled the breast tissue and a small amount of pectoralis major, and the patient is rotated toward the imaging platform, so that the compression plate is close to the edge of the sternum. And the gland is placed in the center of the imaging platform, and compressed to make it the standard side. Position. Continue to pressurize until the breast tissue is firm. Flatten the folds under the mammary gland downward. Pull away the contralateral mammary gland. The lateral and medial positions are opposite, and the neck is stretched forward and the head is slightly tilted. Keep your body still, and please hold your breath when you are exposed later. Please keep still and hold your breath. Start the exposure after holding your breath. Please relax. Image quality control. The outline of the nipple is visible and at a tangent. Breast tissue is clearly displayed without sagging. The post-mammary space image is clearly displayed. Contains part of the pectoralis major tissue stretching at the lower fold of the mammary gland. No skin folds. No motion artifacts. No other artifacts. The image has clear layers. The lesions are clearly displayed, and small calcifications of 0.1 mm can be displayed. Clinical application. Supplementing conventional body position shows poor or incomplete lesions, and is often used for diagnosis or surgical positioning. Body position design and operation process. The patient faces the mammography camera, turns his head to the healthy side, places both breasts on the imaging platform, and stretches all the inner tissues of the bilateral breasts forward to facilitate cleavage imaging, all medial and medial posterior tissues of bilateral breasts. Lesions must be included, the center line. The center is the inner cleavage area of the double breasts, and the X-ray is shot from the head side to the tail side. Image quality control. Fully display the inner breast tissues of both breasts, and try to display the soft tissue in front of the sternum. Uniform breast tissue on both sides. The deep tissue behind the mammary gland is well displayed. No skin folds, no motion artifacts, no other artifacts. The image has clear layers. The lesions are clearly displayed, and small calcifications of 0.1 mm can be displayed. Clinical application for displaying deep lesions inside the breast. Posture design and operation process. The operation technique is the same as the conventional oblique position. The rack angle is the same as that of the internal and external oblique position, and a special axillary compression plate is used. The patient's hand on the affected side is bent and lifted to hold the armrest tightly. The technician adjusts the height of the radiography platform, puts the armpit into the field of view, and pulls from the chest wall, the upper breast and the tail of the axilla. Scope. Breast glandular tissue can extend to the anterior axillary area. In order to display the external breast tissue, accessory breast and anterior axillary lymph nodes, it should cover the entire axillary tail area. And the central line X-ray shoots from the inside to the outside. Place it on the detection plate and press it after fixing it. Image quality control. The enlarged lymph nodes in the armpit are clearly displayed, and the lower glands indicated by the arrows in this position may not be included. Clinical application. When the patient has abnormalities in the armpit and the conventional Malot position shows that the axillary lymph nodes are not enough, it is used to supplement the shooting. Body position design and operation process. First, touch the lesion to clarify the location of the lesion, and use a marker pen on the breast to outline the approximate location of the lesion. You face the machine and hold the handrail with your left hand. The patient's head is then turned to the opposite side. The anterior axillary line is close to the edge of the imaging table. The outer area of interest is pulled, placed in the irradiated eye, and the mammary gland is fixed by slow pressure. After the compression, you can see the mark in the irradiation field. Be careful not to enter the irradiation field with the patient's shoulder. The rest of the radiography methods are equivalent to the CC position. Scope. In CC radiography, the lesion in the deep outer part of the breast is taken as the focus of radiography, and the inner part can be appropriately reduced. Image quality control clearly shows the deep lesion in the outer part of the breast, and the extension near the armpit. Clinical application. When the conventional CC view cannot reveal the deep lateral lesion, the exaggerated head and tail position can be used.